Hi friends, good evening and welcome to my channel Mookambika Nursing. Through my channel, daily we are seeing some important points for exam. Today's important points we can see first one, the last case of smallpox was occurred in India on May 17, 1975 at Bihar. That is last case of smallpox. And second point, India was declared smallpox free by an international commission for assessment of smallpox eradication in the year April 1977. And next point, world last case of smallpox. World last case of smallpox occurred in Somalia on 16th October 1977 in the whole world. And fourth point, smallpox eradication program was launched by WHO in the year 1967. And vaccination against smallpox was introduced by Edward Jenner in 1796. And next point, WHO declared that smallpox was eradicated from the whole world. That is, through the whole world, it was eradicated by the year 1980, 8th May. Okay, next point, causative organism of chickenpox, that is Varicella zoster or human herpes virus 3. That is the causative organism of chickenpox. And chickenpox is transmitted from person to person by droplet infection. One person to another person by droplet infection. And maternal varicella during pregnancy may cause fetal wastage and birth defect. During the time of pregnancy, it may affect the fetus. And incubation period of chickenpox is 14 to 16 days. Prevention of chickenpox is done with varicella zoster immunoglobulin. So prevention of chickenpox we can do with varicella zoster immunoglobulin. It must be given within 72 hours of exposure. The dose of immunoglobulin is 1.25 to 5 ml. Usually it is given through intramuscular route. The route is intramuscular. And the vaccination, that is live attenuated vaccines against chickenpox is OKA strain. This point I have already seen in a question paper. That is vaccination is OKA strain, live attenuated vaccine. And the causative agent of next measles. Measles is RNA paramyxovirus. Measles is also known as rubiola. And the measles is transmitted from one person to another person by droplet infection. And incubation period of measles is 8 to 16 days. And the red spot on the measles, the red spots we can see on the mouth of measles patient is called the Koplik spot. This is also an important point, Koplik spot. And the immunity following measles vaccination develops after 11 to 12 days of vaccination. So immunity usually develop in measles patient is after 11 to 12 days of vaccination. And the disease similar to measles is rubiola or German measles. This is similar to measles. And the incubation period also same, that is 8 to 16 days. And the causative organism of German measles is RNA virus. And the rubella virus can infect the person. If the mother is getting rubella infection, it will affect the fetus and leading to congenital rubella in newborn also. So the vaccination administered against rubella is called RA27/3 and the dose is 0.5 ml. This is also an important point. This question already I have seen in a question paper. Next important point is period of isolation of some diseases. First one, chickenpox. In chickenpox, 6 days after onset of rashes, that is once the rashes appears over the body, the patient should kept isolation till 6 days. And cholera and diphtheria, 3 days after tetracycline started, that is for 3 days. Once the tetracycline started, the patient should be isolated up to 3 days. And in case of polio, for adult 2 weeks and children's 3 weeks should give isolation. For adult 2 weeks and children's 3 weeks. And in sputum positive tuberculosis, that is tuberculosis patient, until 3 weeks of effective chemotherapy, that is once the medication is started for the patient should keep 3 weeks of isolation. And in case of mumps, until swelling subside, that is if the swelling subside, patient should kept in isolation, and pertussis 4 weeks.